Welcome to video 4. In this video we're going to run through pain relief options. So we'll run through natural pain relief options, complementary pain relief options and pharmacological pain relief options. So natural pain relief options, we covered some of these in video 2. So your bath, your TENS machine were covered in previous videos. Massage, so we know massage can be very relaxing. We know if you're relaxed that's going to help build your labour and birth hormones and make you feel a little bit more comfy. Relaxation, so staying relaxed and chilled. Visualization, so visualize your womb getting a little bit smaller with each contraction. So with each contraction your womb shrinks a little bit, with the aim of the game being that eventually your womb shrinks so small that your baby is going to be born. As well, you could bring a visual into the delivery suite with you. So maybe a little picture of your maybe 20 or 22 week scan, because even a little glance at that every so often, a little glance and thinking like that little fella's going to be on my chest doing a bit of skin to skin in a while, something like that might just keep you going through this long stage, and you're most certainly breathing deeply with each contraction. Complementary therapies, aromatherapy is something that we're very open to here in the Rotunda. So if we have diffusers, but if you wanted to bring your essential oils in, you're more than happy to use our diffuser. Just make sure that what you're bringing in is suitable for use during pregnancy. Medication, so pharmacological pain relief options would be paracetamol. So we spoke about that in video 2. So 1 gram every 6 hours would be suffice and perfectly safe to take while you're pregnant. And then pethidine, Entonox and an epidural I'm going to discuss now. So pethidine would be more so suitable in the early stages of like an early labour, in the early first stage. What is pethidine? So it's a synthetic opioid injection given into the thigh. It has a little bit of a reputation for making people feel a little bit sick or nauseous. So we would, as standard, give it with anti-sickness medication as well. It lasts approximately 2 to 4 hours in your system. And what we do know about pethidine is that it's absolutely safe to take, but it does pass through the placenta. And because we know it passes through the placenta, there's a certain amount of parameters that we just need to work within. So I suppose dosage of pethidine. So we would work out an appropriate dose of pethidine based on mum's height and mum's weight. Okay, so we're giving the correct dose to the correct woman. As well, because we know it passes through the placenta to the baby, we need to make sure that we have a healthy, well baby on board and the baby isn't going to be born too soon after we give the pethidine. So to establish that, we just need to make sure that we have a 20-minute fetal heart rate monitoring within an hour that precedes the administration of pethidine. So sometimes that could be a CTG that was performed in the emergency room, or it's something we might do in the early labouring department. As well, we just want to double check that the neck of the womb hasn't opened a little bit since you were checked last. So if it's looking like your contractions are starting to change, maybe become more intense or closer together, we might re-examine the neck of the womb before we give it as well. So that is pethidine. Entonox gas, okay, also known as nitrous oxide. So this is administered using a little handheld device that looks like this. It's suitable from any time in labour where you're more like established labour, when you're more than cervix is more than 3 centimetres dilated. How does it work? So it's immediate acting. So from the time you feel your contractions start to build, you're going to pop the mouthpiece in your mouth, take a big deep breath in, slowly back out. Big deep breath in, slowly back out until that contraction is completely gone. While there's no contraction, you're going to take a few deep breaths of fresh air, and then as you feel the contractions start to build again, you'll re-administer the Entonox. So Entonox is, because it's immediate acting, it is also very quick to wear off. So you breathe it with each contraction, okay? The beauty of Entonox is that it can be used alongside your TENS machine or your bath, so you can layer it with other forms of pain relief. It doesn't pass through the placenta, and you can stay mobile. So there would be quite a lot of slack in that lead, probably about certainly 4 meters or so. So you can move around, you can remain on your birthing ball, on your yoga mat, moving from kind of A to B while you're using your Entonox. So that's Entonox. Side effects of Entonox. Quite often you might have heard it kind of called laughing gas. So quite often it can give you a fit of the giggles for probably 3-4 contractions or 3-4 times you're using it. After that little side effect tends to kind of wear away. It can sometimes make you feel like the room is a little bit spinny as well. This generally doesn't create a problem unless you know you suffer from motion sickness. If you know you suffer from motion sickness, it might make you feel just a teeny bit woozy, but again, to remember, this will be short-lived. It's only for the first 3 or 4 contractions that you breathe the Entonox with. After that, your body will be very used to it. Those little side effects will kind of ebb away, and what you'll be left with is the pain-relieving properties. So that's Entonox. So what is an epidural? So an epidural is a regional block. So it's going to take away any feelings of discomfort you're having from here to here. It is always sited by an anesthetist. It is suitable only when the cervix is 3 centimeters dilated or more. And once an epidural is sited, you're no longer mobile. Okay, so you're no longer walking around. And that's just because your hips are your body's scaffolding. They are within this window of regional block. And the concern would be if you were to jump out of the bed, they wouldn't be able to hold your weight and you would wobble and fall, okay? What are the benefits of an epidural? So the benefits are that it's working well after 30 minutes and it will provide a complete regional block, removing any discomfort from the contractions. What are the concerns that people might have or women might have about an epidural? I suppose number one, it's taking your mobility away from you. So you're no longer able to walk or kneel or go in the birthing ball. You'll need to stay in bed. You won't be able to feel anything from here to here. As I said, so that block is that window. So your bladder is within that window. And you won't be able to feel when you need to pee. And we spoke in the previous video about the importance of keeping an empty bladder so that baby has plenty of room to move down through the pelvis. So we would like to, with your consent, insert a urinary catheter. We'll wait until the epidural is working well before we pop it in, and it will in most cases be removed after baby's born, but before your epidural wears off. What is a urinary catheter, in case anyone is wondering? It is a tube which is inserted into the bladder, which is going to drain urine from your bladder and collect it in a little bag at your bedside. So it's draining your bladder while you're not up walking around and feeling like you need to pee yourself. We will insert an IV line. Okay, so an IV line just into your hand with clear fluids running through. And continuous fetal monitoring until baby is born. So we spoke about this in the previous video, but it's continuous fetal heart rate monitoring until baby is born. What is the procedure? Okay, so if you were to request an epidural, your midwife will call the anaesthetist and the anaesthetist will arrive over to your delivery suite. They'll introduce themselves and they'll explain the procedure. But I'm going to run through the procedure with you now so that you're not hearing it for the first time on that day. So number one, the anaesthetist will gain consent and they'll describe the procedure. Number two, they're going to insert this IV line and the midwife is going to check your blood pressure. You're going to, I suppose, be assisted to sit in an epidural position. So that is where you're sitting on the bed and you're crouched over, usually hugging a large pillow. And the reason we ask you to do this is because this crouching movement that you do, it separates all your vertebrae. So it makes it much easier for the anaesthetist to site the epidural. Okay, so you'll be in that position while the epidural is being sited. When you're sitting in this epidural position, the anaesthetist is going to be feeling your vertebrae and identifying where the safest place to insert your epidural is. Once that space has been identified, it's a sterile procedure, So your anaesthetist will clean down the skin on your back with some antiseptic solution. We allow that a minute or two to dry. The anaesthetist will then give some local anaesthetic to the skin at the area where they're going to be siting the epidural, so that you won't feel anything while this is happening. Once the local anaesthetic is working, the epidural needle is inserted into your epidural space between contractions. So if you let us know when a contraction finishes, and the anaesthetist will work very quickly before the next contraction starts. So we do our best to work while there's no contraction there. Once the needle is in place, the anaesthetist is going to insert a very fine tube through the needle, and once the fine tube is in place, the anaesthetist will remove the needle. Okay. Once the tube is in place and the needle has been removed, the tube is taped in place with a clear kind of sticking plaster, like sticky cling film, and this keeps the tube in place for the remainder of your labour. So the tube is taped to the skin and connected to an infusion pump, which is going to infuse continuous epidural into your epidural space until baby is born. Once baby is born, we'll turn off the epidural pump, and it can take approximately 6 hours for you to be up walking around and the effects of the epidural to be completely worn off. Generally in a class environment, we're asked some common questions around epidurals. So I've just popped them up on the board there. So question number 1, how long does it take for an epidural to start working? Typically about 30 minutes. Okay. Another common question, when is the latest I can receive an epidural? So what we would say is, once you can sit calmly between contractions and your anaesthetist can safely insert the epidural, they will be more than happy to site it. So we don't get hung up on amounts of centimetres, it's more so health and safety. How long before I can get up and walk around after baby's born? 6 hours, okay? But never get up out of bed yourself. Always call your midwife or your student midwife on the postnatal ward, and they'll accompany you for your first jaunt out of bed. Will it affect my ability to perform skin to skin or breastfeed? Absolutely not, okay? So baby will perform skin to skin as normal and feed as normal, providing that both baby and mum are feeling well after delivery. Any questions you might have about pain relief, don't hesitate to link in with the hospital, and we'll get back to you as soon as possible. Thanks a million, bye bye.